Sameer, another question that I receive frequently, and I'm sure you receive as well, is people asking, a couple asking that we haven't had intimacy for some time. Does the lack of sexual intimacy negate the marriage? And what about lack of sexual intimacy, specifically at times of sickness or post-birth, the post-birth situation, etc.? So in general, the issue of lack of sexual intimacy as it relates to a healthy marriage and or possibly ending a marriage. Your thoughts?
I've worked with quite a few couples who are not engaging in sexual intimacy for sometimes months at a time. And there tends to be reasons for this, though. Post childbirth, as you mentioned, I would say pain with sex or vaginismus. And at times, there's even pornography use that has led to such a distance between the couple that they're no longer being intimate. So, what I'm doing is often trying to figure out why this is happening and realizing that there's often foundations in marriage that need to be built back that then lead to intimacy. So I'm often trying to dig deeper to figure out why. And oftentimes couples are asking, hey, is our nikah now valid if we're not engaging in intimacy? And I think you can shed some important light on this topic because it is a common question that couples have.
Well, wow. So I want to ask you some questions, but let me answer your question first. Lack of intimacy does not negate marriage, because intimacy or sexual intimacy is one part of marriage. It's not what defines the marriage. So there's no validating of the marriage contract or anything like that for the type of reasons you've mentioned. Of course, if one spouse refuses for no reason continually to give sexual fulfillment to their partner, that could be a divorceable account. But I don't think that's what we're talking about. But I want to go back to something that you mentioned. You've dealt with many couples who have gone months, without sexual intimacy. Barring the pornography problem, which I'm sure we'll address shortly. Have you found that both partners rather are worried about that, are concerned about that, or is it usually one partner is concerned that the other partner is not engaging?
That's a great question. I would say it's frequently both, that both spouses are concerned, and it becomes the elephant in the room. I find that Muslims often don't have the knowledge and the skills to have conversations with their spouse, such as, we're struggling with intimacy, or I'm having pain, or I don't feel like sharing an intimacy with you. I think these conversations are not happening. So what happens is no conversation happens.
Mm.
So at times the marriage can often be healthy. So they're going about their day, they're engaging with family and friends, they're together as a couple, but then it comes like a roommate situation almost where they're engaging in everything in a marriage, but then intimacy is an issue. It's an elephant in the room. We don't know how to talk about it until something kind of pushes them beyond that. So sometimes it's seeing content online about, hey, pain with sex is not normal, it's not healthy, here's support that you can reach out. So I often find couples often just aren't able to address it until they're given something such as a tool or a language to be able to talk and get support.
So the pain with sexual intercourse, obviously for the on the women's side, is something that I've seen before
Yes.
frequently, and
Yeah.
education is really, I think you're right, is the key to that, because sometimes I don't think men understand that, because I think the man is, grows up to think, well, this is an act of pleasure for both people, to give and to receive, etc. And I think they don't realize that there is pain involved. I mean, certainly that's not how I grew up. So that was something that I had to learn when I was older. So I think I want to highlight that that's also very important. The other thing that you also mentioned, and maybe bears sort of stressing on, is that, intimacy, it's not just a sexual act. It's not just
Mm-hmm.
like either there is sex or no sex in the marriage, but you can be intimate without having sex.
Yes.
And husband and wife can flirt with one another, husband and wife can send messages to one another, and those messages and those acts and that flirtation, for example, and I'm just using that as an example, doesn't have to lead to the sexual act. It could just be, we're just being intimate for the sake of being intimate. And I think that foreplay is something that we don't speak about. The Prophet ﷺ spoke about it. He advised men not to pounce on their women as animals do. to send a message, in other words, foreplay. And I think that that's also important part of our education to young couples, is to teach them that this is part of the process, and romance and the ongoing intimacy is something that is does not have to be just linked with the sexual act, because you can be intimate with your spouse when they're sick. You can be intimate with your spouse when they're not physically present. They might be at work or traveling or whatnot. In addition to respecting, this is more, I think, for men towards women, especially if children are involved, that women, post-birth, you can't have intercourse with women, because there is the postnatal bleeding in the Sharia called a nifas, which can last 40 to 60 days, roughly, an average of 40 days. It's just like the menstrual cycle. So there are going to be periods where a woman can't engage physically for Sharia purposes, and also she's emotionally, she's not with it at that time. So God created us this way, that there are on times and off times, and that we need to also respect that.
That's a very critical point, that it's not an all or nothing. Like, sexual intimacy is not all or nothing. And I often use the analogy of intimacy in marriage as a menu. And intercourse is one item on the menu. And oftentimes we think that that's all there is to order, or that that's all there is that we need. So there's a tendency to just go there because intimacy is oversimplified. So I'm often working with couples, let's work on this menu. Let's work on this menu during menstruation, when intercourse is not allowed. Let's work on it when your spouse is traveling, as you said, or postpartum. So I think the more skills that we give to couples, the menu becomes a little larger. And like you said, we need those foundations and the foreplay if we're moving towards the sexual act.
Well, just to go off that, I love that concept. So with your permission, I'm going to start to use that. But not to get too specific or graphic, but if we were looking at that menu, the sexual act itself probably consumes the least amount of time as all of the other things. So being romantic, intimate, foreplay, whatever the words we're using, if you think about the time investment, those things are going to take more time than the act itself. And I think that when we reduce intimacy just to sex, first of all, that's not our paradigm, because our paradigm is a paradigm of love, a love and mercy. Well, if you love somebody, you're going to love them all the time, in the morning and in the evening, when you're tired, when you're not tired, etc. And if you reduce that love just to this one act, I think it also sends another message that you really don't care about the other person other than to fulfill this act. So the real work is in the off time. It's in the other items on your menu, because those are the things that will take the most time. Are you also intimate when she is not ready? Are you intimate when he's not ready and romantic? I think that's really, really important. And you just sort of are giving me more ideas now of how better to help people that come to me.
That's wonderfully stated. Yeah, I know, absolutely. It goes both ways. And like you said, adding more nuance is so important. So we're not seeing this as a black and white subject matter.